Okay, welcome. Today we're going to be talking about preclinical conversations. And just to give you a little background, if you're listening to this, you probably know this, but my name is Dr.Cairns. And the reason I work with PDS Health is to enhance the lives and livelihoods of all the general dentists who choose to work with us so that they may best serve the patients and themselves. All right, let's move on. So, something that you probably give very little consideration is the shingles that are on the roof of your house. Unless you've had a hailstorm or you've had a tornado or some kind of big wind event and you're having to replace your house, the roof on your house because it's leaking, it's probably not something that you give much consideration at all. It's there, and until it's time to replace it, you don't think about it. Well, the truth is, our patients don't think about their mouth much at all. They don't think about their teeth. They don't think about their gums. They're reminded about it a little bit more than the roof every day because, for the most part, they have probably pretty good habits of oral hygiene of at least brushing once or twice a day and maybe flossing. So, but other than that moment in time, they aren't thinking about their teeth unless they're looking at them in a photograph. So, what is a preclinical conversation? It's about setting the table for a conversation about something that they aren't really thinking about, which is the health of their mouth, their oral cavity, and all the different tissues that are there and that are associated with dentistry. So, first, you need to get your mind in the right place as the doctor. What is it that you're trying to accomplish? Do you have a goal for this time? You have to think about this from the patient standpoint. And this is a time to use interrogatives. How, when, where, which, whose, whom. Be very careful of why, because that one can create defensiveness in the patients. You want to control your tone. You only get one chance to make a good first impression. This is your first impression with that person. So come across the way you want to be coming across. And hopefully that's compassionate and kind. You want to use we and not I because you don't want it to be all about you. The patient cares much more about them. So there's this preclinical conversation. We're going to be reading people. So when it comes to communication with people, 7% of it is verbal. And we think it's probably way more than that. 38% is the tone of voice. What are they picking up on that you're not saying, but your tone is conveying? And then 55% is body language. So you have to be very careful about looking the part of being interested. And of course, that starts with actually being interested, and then your body will follow along. Remember, people don't care. This is Theodore Roosevelt, President Roosevelt, that said this. People don't care how much you know until they know how much you care. You must establish rapport before you begin an examination. And part of developing the rapport is letting them know that you care enough to spend a few minutes with them learning about them and about what brought them in. I like to think about the preclinical conversation. You have this mystery person, right, who's kind of behind the curtain or behind the opaque glass, right? They're there, you know they're there, you can talk, but you don't know anything about them. Patients are a mystery and they need to be solved. And there's a tool, there's several tools that you can use in your conversations with patients to clear away the fog on the glass so you can actually get to see them and get to know how you're going to fit. And this comes through the use of something called continuums. So a continuum is essentially, a progression from one end of something to another. So like color, from dark to light to dark again, right? So where are people on that continuum of red, blue, green, yellow, all that kind of stuff? People aren't ever on a color continuum, but but that's just as a visual. So all patients are unique, and we have a bunch of different continuums that we can instill or utilize as like tools in the tool belt to figure out people. Those are just really quick: motivation, focus, value. How much value do they place on dentistry? Trust, awareness, and desire. And we're going to go through each one of those specifically. We'll start with motivation. So motivation is going to be either are they reactive? Are they proactive? So, here are questions that you can ask that will help illuminate where they are on that continuum. Are they more towards the reactive or more towards the proactive? And so one of those questions is, what made you visit the dentist today? You can get a bunch of different answers there. Regarding your healthcare decisions, do you consider yourself more reactive or proactive? Just ask them straight up. Most people will know what you mean by that, but sometimes you have to give a little color. Do you more wait until the problem is bigger, or would you rather take care of it when it's smaller? So that's the next question. When it comes to your health, would you rather wait for the small problem to become bigger, or would you rather manage the problem as soon as it is discovered? So what is their motivation? Is their focus, is it specific or is it broad? Would you would you like to only look at this, whatever they said? I came in because my tooth hurts. Or would you like us to look at everything? Sometimes they want us very specific, narrow focus. And sometimes they're like, no, I want to hear the whole story. After awareness and consequences, is this something you are concerned about? So after you've asked them that question, you've made them aware of a situation and they know what's going to go on. Is this something that you want to focus on? After your diagnosis, we have found a bunch of stuff. Where are you most interested in beginning? Like, where's their focus? Where do they want to begin? We want to meet patients where they are and then bring them along. How much do they value dentistry? So you can have them, just tell me about your previous experiences with dentistry. That's going to tell you, they're going to start to explain things to you, and then you have to be a investigator and pick up on the clues that they leave you in that conversation. What do you do every day to take care of your teeth? And what do you do occasionally? That tells you how much they care. It might tell you what they know and what they don't know. But obviously, if somebody's brushing 3 times a day and flossing twice a day, they must value their mouth. What's more important to you, the best way to solve the problem or what an insurance company is willing to do? I skipped one there. What's more important, how long something lasts or how much something costs? Those seem like they're really aggressive questions, but they're very appropriate because in dentistry, we have choices when it comes to how something's going to be fixed. Sometimes we want to do something that is a quick fix, and that because that's what the patient wants, and sometimes we need to do something a little bit more enduring. Trust. So trust is huge. Have you ever had a bad experience in dentistry? Tell me about that. And what have you tried that hasn't seemed to help? So if somebody's had a lot of dentistry and they just are getting frustrated with it because it keeps failing, it's not that they don't trust you. They don't trust dentistry. it just doesn't seem to work for them. It's way more important to know that at the beginning of the relationship than it is later on. Another one is awareness. Like, where do they think they are? And are they deluding themselves at all? So, what level of oral health do you think you have on a scale of 1 to 10? 1 being the worst oral health you could have, and 10 being the absolute best, everything's perfect. Where are you? And then they are forced to kind of rank themselves. And then the most important part after that is to say, where would you like to be? So if somebody says, oh, I think I'm a 5, and then you ask them where they'd like to be, and they say, I'd like to be a 5, then it's going to be hard for you to motivate them to do any dentistry. But if they say, I would like to be a 9, and I think I'm a 5, and then you can look in there and, they don't have to be right? However, sometimes this also helps you, if somebody looks in their mouth, or if they think they're a 9 and you look in there and they're like, oh my God, this guy's a 2, right? Nothing is good in that mouth. Everything's broken down and terrible condition. Well, you have a lot of work to do to make them aware of the difference. Conversely, if they think they're a 2 and they are a 2, then they already kind of know what's going on. So you don't have to spend as much time convincing them of the need for dentistry. And then what's their desire? What's the continuum? It's going to go from low expectations to high expectations. So here are a bunch of different questions to consider. Has your dentistry always met your expectations? What are your expectations for your experience in our office? That was one of the first questions we asked at the beginning of the show here. How important are the aesthetics or cosmetics to you regarding your dentistry? When you look at your smile, what do you see that you like and what don't you like? In the past, what has motivated you to do dentistry? These are all good questions